Thank you. Good morning, esteemed faculty and audience. My keynote address is on the study, Comparison of Choroidal Thickness in Preeclamptic, Healthy Pregnant and Non-Pregnant Females by Optical Coherence Tomography. So preeclampsia. Preeclampsia is a multifactorial, multisystemic disorder occurring in approximately 5 to 10% of pregnant women worldwide. It causes various organ dysfunctions, including the visual system. And high vascularity with poor autoregulatory mechanism makes choroid particularly sensitive to the hemodynamic alterations in preeclampsia. Thus, assessing the choroidal thickness may be used as a predictive marker in preeclampsia. A very few prospective comparative studies are available on the choroidal thickness, and it is also limited by various conflicting results and small sample size. So the purpose of my study was to measure and compare choroidal thickness in preeclamptic, healthy pregnant, and age-matched healthy non-pregnant women, and to evaluate any correlation between the subfoveal thickness and the mean arterial pressure. So we took 30 healthy pregnant women, 30 preeclampsia women, and 30 age-matched healthy non-pregnant female as controls, so total of 90 subjects. It was a hospital-based comparative cross-sectional study, and the study duration was 12 months. The inclusion criteria was 20 to 40 years of age and with less than 4 childbirths, and best corrected vision of more than 6/9, and OCT images with good signal strength. We excluded any pre-existing systemic illness or pregnancy-related complications. After detailed workup, we included the best corrected visual acuity, IOP, the corneal thickness, spherical equivalent, examined the axial length, slit lamp, and fundus evaluation. Then we measured the choroidal thickness of both eyes in the SD-OCT in the EDI mode. And we also measured the mean arterial pressure. In the lab investigations, we did take urinary protein. So this is the representative image of the 3 groups, which is the subfoveal and nasal and temporal measurements are taken manually. And the A image shows the preeclamptic group, the B is the healthy pregnant group, and the C is the non-pregnant women. So our results, first we compared the obstetric, ocular, and systemic parameters of each group. Then we compared the choroidal thickness between the groups, and we found that there was a significant difference in the subfoveal, the nasal, temporal, and average choroidal thickness of both the right and the left eyes. So what do we see here? That the healthy pregnant group had the highest choroidal thickness, followed by healthy non-pregnant women. And the preeclampsia group had the thinnest choroid. The difference in the choroidal thickness in the 3 groups was statistically significant for nasal, temporal, and subfoveal average, both eyes except nasal CT in the right eye. And the correlation of mean arterial pressure was also done with this choroidal thickness, and it was found to be inversely related in all the groups combined. But it did not show any significance if compared with the single group separately. So the current study showed significantly less choroidal thickness in preeclamptic patients as compared to the other groups, and no significant correlation was found between the mean arterial pressure and choroidal thickness in preeclamptic patients. So this has a very strong implication that choroidal thinning in preeclampsia is not governed by multifactorial choroidal vasospasm and endothelial dysfunction, which is causing this thinning, and it is not solely attributed to the mean arterial pressure. We have other studies in literature, and there was no study, PubMed index study from India, so our study was the first one. Other studies had contrasting results as well, where few studies showed that there was a choroidal thickening, such as Kim et al. And Choroidal et al., and few studies showed that there was choroidal thinning in preeclampsia. This varied results could be because the various degrees of preeclampsias, and we made sure that all the 30 preeclamptic women in our study were of mild to moderate preeclampsia levels according to their urinary protein, and the severe preeclampsia was excluded for the comparable results. So in conclusion, choroidal thickness can be used as a biomarker in preeclamptic patients, as an adjunct to other parameters, and future prospective comparative studies with follow-up, larger sample size are required for better understanding. Thank you.
Thank you.
Thank you, sir.
In fact, how can we use it clinically for this? Because eclampsia and preeclampsia would mean fluid retention.
Yes, sir.
Yeah.
So,
But that would mean the choroidal thickness should be more?
Yes, sir. In healthy pregnant women, the choroidal thickness is increasing. But in preeclampsia women or the women which are going to go into eclampsia or severe disease, so as a part of an antenatal workup, it is a non-invasive thing.
That's
so we can screen the women who are at higher risk of developing vision loss. So we can, and also this adds to the literature that choroid is basically an eye to our systemic system. Any systemic disease can be correlated with the choroid. And the limitation of my study was also that we did not have OCTA. So choroidal vascular index and all these parameters are also yet to be studied in such systemic diseases. So choroidal changes are very important, which are occurring.
So what will be the pathogenesis in eclampsia, preeclampsia? Why it is thinning?
Yes, sir.
Is it because of hypertensive or some atherosclerotic or arteriosclerotic changes occurring there?
Previously, this was believed that because of it is a direct correlation with BP, choroidal vasospasm, and thinning. But newer studies and even our study adds to this literature that it is not only the arterial pressure, it is endothelial dysfunction, endothelial choroidal vasospasm, because of which this thinning is occurring. Otherwise, in healthy pregnant women, there is increase in blood flow, and overall the whole body has increased blood flow and also the choroid.
Did you correlate this to the refractive error and the axial length?
Yes, sir. So all the groups had comparable axial length, and we did a spherical equivalent also. So we had excluded any refractive error, which was +3 to -3. So all three groups were having comparable results statistically. Thank you.
Thanks a lot. Thank you.
Thank you, sir.